Hello, it's Hannah here from Physic Health Consulting. Today I wanted to talk a little bit about hot flushes because it's probably the #1 most common health issue that I deal with in my herbal medicine practice. So over the years I have treated hundreds of women and actually a handful of men as well, believe it or not, with hot flushes. Obviously the most common cause, particularly in middle-aged ladies, is perimenopause, and the hormone changes that come with perimenopause and menopause can trigger hot flushes, although we're not entirely sure exactly how that happens even now. Nonetheless, it's worth bearing in mind that there are other potential causes of hot flushes as well besides menopause. So if you're trying all the usual tricks that ladies tend to find out about at this time of life, things like cooled sage tea, and nothing is touching your hot flushes, it's worth having a chat with your GP and seeing if they will look into other possible causes with you. In terms of herbal treatment, in my experience, hot flushes do respond very well to herbal medicine. Many of my patients get a general improvement within a week to 2 weeks of starting on their medicine, and some actually get the flushes disappear completely within about 8 weeks of starting. In a few cases, it can be a bit of trial and error involved and it can take a bit longer, but generally the flushes will improve certainly on herbal treatment. All the medicine is tailored to you because we're all different. We've all got different stuff going on behind the scenes. We've got different lifestyles and different triggers. So there's no two prescriptions the same. Your medicine is made up exactly for you based on your first appointment, during which time I ask you lots and lots of questions. And I do that because what I'm trying to do is build up a picture of exactly what's going on and which herbs we need to redress the imbalance that's causing the flushes. If you are one of those ladies who has concerns about taking herbs with phytoestrogens in, so things like sage, for example, that is not a deal breaker as far as your herbal treatment goes, because we do have other options for dealing with flushes without any of those kinds of herbs. Personally, I don't think we have cause for concern with herbs that contain phytoestrogens, but if it's something that really worries you, I wouldn't give you those herbs because there would be no point. I don't want to add to your stress levels. So we do have other options. We can work on things like liver clearance, and we could potentially use herbs like Vitex, which are not hormonal in themselves, but still do have a hormone balancing effect. So we have lots of different options. It's safe, it's effective, you get tons of moral support as well, which is very, very important. And if your hot flushes are ruining your life, making your day a misery, keeping you up all night and just making you generally exhausted, it's well worth exploring herbal medicine as a potential treatment. So if you're watching this on social media, please message me now to book a free call with me so that we can discuss what's going on for you and look into your treatment options. If you're watching this on YouTube, you can still get in touch with me via my website, which is at www.physichealth.uk, and I will speak to you again soon. Bye.